Mayor Walt Maddox, I know it's been a very busy day. I thank you so much for giving us a couple of minutes of your time.
Hey, Ryan, it's the least I could do. We want to keep people updated as much as possible.
Let me just give you the flexibility to go where you need to go. What message do you need to get out here on a Thursday afternoon?
Well, this is about responsibility and not fear, and there's a difference between the two. And the steps that we're taking as a city, the steps that the governor's taking, the steps that the president is important for us moving forward so that we mitigate this as soon as possible. It's not about where the numbers stand today. It's where the numbers could be if we don't take action. And the short term, one of the phrases we've been using is we need to make this deep but short so that we don't get into a scenario where we lose, let's just be blunt, football season. We need to go ahead and deal with this now, address it proactively, and move forward. And that's the task of our team. If we do that, we'll save lives, we'll reduce sickness, and we'll get back to a state of normalcy quicker than maybe other parts of the world.
It may be too early to tell, but all the effective measures that you're putting in and the state of Alabama are putting in, are these things working?
I would like to think they are. I think we really won't know.
Sure.
Testing is so far behind. As of this morning, we don't know what today's tests are. We have about 800-plus tests that haven't been tested in Tuscaloosa. So we don't know what the impact they'll make, and none of us will never be able to quantify who didn't get sick because we did X or Y. But I have to believe that what we're doing is going to work. I think the university has done a fantastic job. They've had to make some draconian decisions themselves, and certainly it's going to have a deep economic impact. But I believe it will mitigate that economic impact if we can contain it to. We can mitigate that economic impact if we can keep it in the short term.
Understanding that your background is not to practice medicine, but I'm curious if let's just say that you present with these type of symptoms and you go through the screening facility there that's set up, and I think you guys have done a great job of setting that up. I've heard you on several different shows here on our cluster talking about the resources and the workers that are working long hours to provide us. But let's just say that you present yourself. Do they begin treatment or do you have to wait for a test? And I know there's not a lot of treatment, but what exactly do they do in the process of waiting to show a positive or a negative test?
Well, when you go, we've had over 1,000 people go to the screening. About 800 had been tested as of 5 o'clock yesterday. Unfortunately, these tests run through, when I say unfortunately, not that they run through the Alabama Department of Public Health, but it can be days before you're notified. So we are asking people, if you're presenting symptoms, even if you've been tested, please make certain that you go ahead and begin self-quarantining yourself to prevent the spread. I'm here at our command center, which we've moved to the amphitheater so we can create more social distancing. Every time I walk in the door, I have to get my fever checked or my temperature checked so I don't see if I have fever. All these steps we're taking, we hope every business is taking so that we can make sure to minimize the person-to-person spread of the coronavirus. It is what makes it so different and so deadly is that it's highly contagious. It doesn't die as easily as the flu virus does, and its impact is several times greater in terms of creating death rates of those that are infected. So we do know that that's a big impact that we need to mitigate because it only takes about a 2 to 3% infection rate for our hospital to become overwhelmed. So really, we hope that if we can keep our rates low, then we'll ultimately know that if we have our healthcare system not crumble, that we've done our job.
Are you aware of any medical shortages that we have in our community?
No. DCH has stepped up in a very big and powerful way. The testing center was their design, their idea. The city just supports it, and our first responders have been fantastic, and their people have been unbelievable and have really put themselves in harm's way to do that. Right now, we are good, and to me, that's a good sign. Now, certainly, even with the university shutting down, there's going to be somewhere in the neighborhood of 15,000 plus students that are going to come back into our community because they have existing leases and apartments. What does that mean? I think we all have to wait and see what the next few weeks bring.
When you look at the setup that you guys have for DCH, and I've shared this story a couple times. My wife and I, she was at a conference over at Duke University. We were in Durham, North Carolina, and we started watching this break, and we actually left a couple of days early, even though they were not releasing. And we just said, we just feel more comfortable back at home, back in Tuscaloosa, we have watched you guys respond to so many different situations. And, it's the confidence that we have in our community. I'm not here to say that my community is better than other communities, but I think it's when you are one of those that sets the standard of the way that you respond to a certain situation, that should make all of us feel a little bit more confident in what you guys have been able to accomplish and what you will continue to be a step ahead of the game.
Well, I'm very biased, but we have the best team in the nation when it comes to city employees. Just to kind of give you an idea, Randy Smith, who's our fire chief, and fire is also over EMS and rescue, and his background is actually in this. In fact, Randy served on the incident command team for 9/11 in New York City, so he has vast experience. Wow. He began talking to me about this in December. I authorized him after he requested it to begin ordering supplies and to begin putting together a design plan if this event really took place. In February, upon his request, I activated Incident Command, and that's why we've been able to be as effective thus far. And so he deserves the credit, and all of us are just working to support his efforts. And so I'm very proud. And if I, as a citizen of Tuscaloosa, I feel safe for my family, and I can say that without any equivocation. And I wouldn't want my family anywhere but in Tuscaloosa, Alabama at this moment. If we get overwhelmed, it won't be because we haven't used everything in our arsenal at the highest level to protect the people of this community.
Well, I think it goes to without saying that people have come into Tuscaloosa and studied the way that you guys responded to, especially the April 27th storms. They've come in, and it's still, I have a hard time even wrapping my head around some of the things that you guys, when we look back at the stats, communication, the center infrastructure hit, and still been able to do what you guys were able to pull off. I guess it's a little different situation, but it kind of establishes that you guys are setting the standard throughout. Let me ask you another question. From an economic standpoint, I heard you a couple of days ago in a press conference, and you said, I'm going to order takeout. How can we continue? I mean, I've tried to encourage that, but even you during that press conference encouraged me. I called my wife and I said, hey, freeze the meals that we're planning on eating tonight. Let's support those local businesses.
Well, like today, on me, not the city, on me, I bought our IC team lunch from Southern Ale House, and then I thought, well, if I'm at Southern Ale House, I might as well go to Peterbrook and get some chocolate.
Sure.
And so anybody that can go to where they're having takeout, where they're a small business, go get a gift card, go get something for Easter, go order out dinner. Those small things make a huge difference for the local economy. And so I've told my team every day, let's go. I normally bring my lunch, so I'm not the guy that goes out to eat a lot. But I said, you know what? I'm going to go every day and buy something from a local business because we need to keep these guys open because they're taking it on the chin. And whatever we can do, and it can make a big difference, especially as I told our own team, we're going to get a paycheck every 2 weeks because, we're lucky enough to be working for the city of Tuscaloosa. But the people working at Southern Ale House or Catfish Heaven or whatever restaurant, they're not guaranteed anything because they have to live with what comes in that door. So anytime we can help them, I want to do everything in my power to help them so they can make it through this rough patch. And you know what, Ryan, you and I have talked about this before. Tuscaloosa is an unbelievable community. Our compassion, our generosity, I have no doubt will rise to the challenge.
Well, when you look at, let me also rest assured here, because I think a lot of people, we do hit that panic button. And listen, it's one of those that grabs all of our attention. But there's not a food supply shortage. That food chain, I don't see an interruption. Do you?
No, we haven't seen any interruption. Now, if we get to a Italy type scale, that could present some problems. But right now, and again, science will, ultimately the results will determine what happens. But I believe we are proactive. I'd like to believe everything we've done is going to help mitigate and flatten the curve and help us get through this. And I hope a month from now, Ryan, people are calling in going, boy, Walt Maddox overreacted. If that happens, I'll be the happiest person on earth because that means it's over with, and then we can go back to living our lives again.
What other measures are you looking at? Is there that next tier of measurements that you could implement? I mean, I know you've kind of been a step ahead of a lot of these different conversations. We're seeing a state, not an established rule on the restaurant stuff that we put in a couple of days ago. Is there a next tier of measurements that you're looking at implementing?
Well, I mean, I could implement an overall curfew just to lock everything down, but I am not there yet. I'm still, the thing we're having to balance because I still think fear is more of an enemy than the virus itself. And I'm a firm believer that if we're smart, we apply common sense. We do everything we would do to avoid the flu. My parents are in their late 70s. I'm not going to see them, just on the case that if I did have it, I wouldn't want to expose them. I'm washing my hands all the time, using hand sanitizer. I'm trying to practice as much social distance as possible. I believe that by taking those steps, I'm being a responsible citizen of our city, state, and country. I think if everyone takes that type of approach, then we can get through this together.
I want to go back to a final question here. We're talking with Mayor Walt Maddox, the mayor of Tuscaloosa. You mentioned football a couple of minutes ago. Is that a realistic thought, though? I mean, we're this far away, and I'm not doubling down on the question. I'm just when I heard you on with Jay Barker on this station a couple of days ago with Lars and Antonio Langham and Trent Richardson and Tony Curry, and you mentioned that, I've explained to the audience that was my attention was already grabbed, but it was enhanced when you mentioned that word. Is that a realistic option? I mean, you look at that as a thinking that we could get there?
Yes, I do think it's realistic, and it's realistic for two reasons. One, we have to get our house in order in the state of Alabama and mitigate this probably in the next 6 to 8 weeks. Second, we don't know what the national climate will be. And certainly it's more than just Alabama, it's the rest of the nation. So it certainly is in the realm of possibility. That's why I was very pleased last week to see the president, and I've been very pleased that the governor are taking strong actions on top of what we're doing. Because quite frankly, as a football fan, I don't want to lose football season. From a humanitarian standpoint, if we're getting in the football season, that means our people are hurting a lot. And from an economic situation, it almost creates a depression-like era around Tuscaloosa, Auburn, but quite frankly, our entire state. And so that's why really this is an American call to action. It is that serious. The good news is that we're still, I believe, ahead of the game. And I believe if we take those necessary steps now and treat it seriously, then we can win this battle. Ignore the numbers coming from the Alabama Department of Public Health. Those do not present that is not a reality. That is, testing is far behind the curve. This is real. It's serious. And the White House on down believes it so. So let's address it, let's knock it out, and let's get our lives back this summer.
You can connect with Walt Maddox via his Twitter account. It's straight up at Walt Maddox, and the Tuscaloosa City Twitter account, straight up at Tuscaloosa City. Thank you again for spending a couple of minutes with us. You've always got an outlet here if you need to continue to get the word out. We appreciate what you guys are doing for our community here in T-Town. Hey,
Ryan, you're terrific as always. Anything you need, let me know.
Thank you. That is Mayor Walt Maddox helping us out, and I appreciate the conversation with him. It was a tension-grabbing conversation as he was talking about it, but I also think it's an insurance policy when you talk about the city of Tuscaloosa, what Alabama's been able to do. But it seems like even when you look at the state of Alabama, they're even a couple steps behind what's happening here in Tuscaloosa. And I think the quick response that the mayor, I think did he say that he first heard about it at the end of December? He said that's when someone that I believe he said the chief of the fire department, who was on the 911 side of things, of studying that and understanding on that panel, was one of the first ones who brought that to his attention. And I think it's that planning phase. So he also encouraged us to go out and support those local businesses, and I'll continue to do that. For the last 3 meals, I bought out every single meal. I just feel an obligation to support those. If it's not the gigantic meal, maybe it's something small just to keep those small businesses going here in West Alabama. I know the mayor talked about Southern Ale House. That's one of our great sponsors, 1530 McFarland Boulevard. And I think it's also to give us insurance on looking at what they're doing. Look at how they're doing it with the gloves and the precautions they're taking. I think that's pretty impressive when you talk about. I mean, we were already doing this, and I had lunch. Southern Ale House, what was it, Sunday, Monday, whatever it was, and they were doing it then. And now they continue to do it, but they're, going through the different established criteria.